Okay, some features of the skull and of the cranium. All right, now we're going to talk about some features of the skull, the cranium in particular, sutures and fontanelles. So sutures are joints between the bones of the skull. They are composed of dense connective tissue. Sutures are found pretty much only in the cranium of all of the joints in the body. So when you hear the word suture, think right away of cranium. The sutures include the coronal, sagittal, lambdoidal, squamous, and frontal nasal sutures. So there is the coronal suture, the sagittal suture, and the lambdoidal suture. And that is our superior view. And then there is the squamous suture and the frontonasal suture. Like that. So now you know where they are. The coronal suture joins the frontal and parietal bones. The sagittal suture joins the two parietal bones. The lambdoidal suture joins the parietal bones and the occipital bone. The squamous suture joins the parietal and temporal bones primarily. This frontonasal suture joins the frontal bone and the nasal bones of the face. So here's our frontal bone. And here's our nasal bone, which we haven't learned yet. And there's that suture. The skull changes from birth to maturity. The bones of the cranium are not completely ossified at birth. Ossified means made into bone. So the bones of the cranium are not completely made into bone at birth. Fontanelles, commonly called soft spots in the skull, are areas of the skull with fibrous connective tissue instead of bone. The anterior fontanelle between the coronal suture and the sagittal suture is the largest, and here it is, right? Sort of in the coronal suture, kind of in the sagittal suture, and yeah. And there's sort of even a split in the frontal bone where the anterior fontanelle extends. So this is the largest fontanelle. There are three other fontanelles. There is the posterior fontanelle, posteriorly, the sphenoid and the mastoid fontanelles. This is the sphenoid fontanelle. Here's the arrow going to it. Kind of a bendy arrow. Let's see, do that better. So the sphenoid fontanelle, and then the mastoid fontanelle, say in this area above the mastoid process. Okay. The fontanelles are flexible, and during birth, the skull of a fetus can be compressed without damaging the brain. The fontanelles also allow brain growth after birth. The anterior fontanelle closes at around 12 to 18 months. The other fontanelles close earlier. The posterior fontanelle closes at around 2 months. The skull itself completes growth at around age 5. Wow, we have our skull that we'll have for life at around age 5. That's crazy, but that's why kids like to look like they have really big heads. The cranium of young children is relatively larger than that of adults. So little kids look like lollipops with big heads. And now let's look at the little pictures. I want you to note the picture on the right that's showing that there can be extensive molding of the head because of these fontanelles. So minutes after birth, the child might look like the picture on the left in the tiny little postage stamp here up on the right, like a little cone head, right? But after only 24 hours, the child has a round head, and you can put a little hat on it. The other stuff we've seen in the last slide. All right, so that was sutures and fontanelles. Okay, so moving on to the face. The face bones can be learned in a sequence that starts with the bones that can be seen in the anterior view of the skull. More challenging to see are the bones in the nose and the mouth, and so we'll pay special attention to those. Here's a picture of the skull showing the face. Of course, the frontal bone, and then going backwards are the parts that we just talked about. And now we're going to talk about the face, which is anterior and even inferior to the cranial bones. Okay, this is going to be our face. Oh, getting the temporal bone in here. So this is going to be the face. Ooh. Okay, I just want to draw a quick, giving them a roughly mandible. And we've made it around. So there is our face attached to our cranium. Okay, so the face, starting at the nasal bones and moving inferiorly to the maxillae, which some people describe as one piece and other people describe as two pieces. Martinis describes it as two separate bones, so we will describe it in our discussions as two separate bones that are joined in the midline. But in any case, that's where it's not called maxillae in this little picture, but instead maxilla. But okay, so starting at the nasal bone, going to the maxillae, and then the zygomatic bones laterally, and then the mandible, and then looking inside the nose and the eyes, there's the lacrimal bone here. Can't see it because of the eyeball, but there it is in the medial wall of the eye socket. Then the inferior nasal conchae inside the inferior nasal cavities, the vomer bone, which is the inferior part of the nasal septum, the perpendicular plate of the ethmoid bone being the superior part of the nasal septum. So when you look at a skull, you can see all of these bones actually without too much trouble, okay? Some of them are really easy, the nasal, the maxillae, the zygomatics, the mandible, that's low-lying fruit. But then the lacrimals can be seen, and the inferior nasal conchae and the vomers can be seen in a skull without any trouble, okay? So let's start with the nasal bones. The nasal bones form the bony part of the nose. Septal cartilage extends from the inferior edge of the nasal bones, so the part of your nose that you can wiggle back and forth, that is septal cartilage, and the part above it that you can't move is the nasal bones. Okay, the cartilage gives flexible support to the nose. Of course, we have noses of all different shapes and sizes. The maxillae are the largest bones of the face. They form the upper jaw that holds the teeth. They articulate with all the other bones of the face except for the mandible, which although they close to help us chew with the mandible, they do not actually articulate. They do not form a joint with the mandible. But note, they are articulating with the nasal bones, the zygomatic bones, the lacrimal bones. I think a pen is in order. So the nasal bones, there's a joint. The zygomatic bones, the lacrimal bones, the inferior nasal conchae, the vomer, and the palatine bones, part of which is seen here and part of which is not seen down there. Oh, you can just see a little teensy little bit of it here. Okay. Barely seen, right? The palatine bones. So those maxillae, they are just right in the center of everything. The maxilla bones contain the maxillary sinuses. They form most of the hard palate. Here we have the maxillary sinus and the maxilla bone. And you saw it. Now we'll get rid of it. And the hard palate. So what we're seeing here is if we look inside here, okay, here, here, the floor of the nasal cavity is actually formed by an upper shelf in the maxilla bone. And here is that shelf forming the hard palate. This is the superior surface of the hard palate. The inferior surface of the hard palate down here is in the mouth. And that's what we can rub our tongue against, when we feel the roof of our mouth. Okay, now moving on to the mandible. The mandible forms the lower jaw. The mandible has a horizontal body and a ramus, and the ramus has a condylar process and a coronoid process. The condylar process is posterior and the coronoid process is anterior on the ramus. The posterior condylar process articulates with the temporal bone at the temporomandibular joint. So here's the condylar process articulating with the temporal bone, which is here at the temporo for temporal bone, mandibular for mandible joint. The anterior coronoid process is the attachment point for the temporalis muscle that closes the mouth and helps with chewing. And over here we have the temporalis muscle in green, and it's attached to the coronoid process. So the condylar process forms the temporomandibular joint, and the coronoid process is an attachment site for the temporalis muscle. The temporomandibular joint is quite mobile, as it turns out. The mandible can move superiorly and inferiorly and from right to left. And many people have temporomandibular joint disorders. In some cases, the mandible dislocates from the temporomandibular joint when the jaw opens. So if we look at the picture here at the bottom right, they're showing the condylar process of the mandible slipping out of the temporomandibular joint when the jaw opens. That occurs in some cases. There can be other things going on in this joint that can cause a problem. But in general, we can say that temporomandibular joint disorders cause pain in the joint and surrounding muscles. The zygomatic bones form the cheekbones. They have a temporal process that joins the zygomatic process of the temporal bone to form the zygomatic arch. And again, all the things I said the last time when I was talking about the zygomatic process of the temporal bone, and now applies to the temporal process of the zygomatic bone, right? It's easy to get them confused, but think about which bone the process belongs to as an anchor to keep yourself from getting confused. So the zygomatic bones, as well as forming the zygomatic arch, form the lateral walls of the orbits. The lacrimal bones form the anterior medial wall of the orbit. They're shown here in green. The inferior nasal conchae are two bones on the lateral walls of the nasal cavities. Like the superior and middle nasal conchae of the ethmoid bone, the inferior nasal conchae increase the surface area of the nasal cavities in order to warm and moisten air before it passes to the lungs. Okay, the palatine bone. The palatine bone is L-shaped. It has a horizontal plate that forms the posterior part of the hard palate. The horizontal plates join with the vomer bone in the midline and support the vomer bone. The perpendicular plate forms the vertical portion of the L, and that goes up high enough that a little bit of the palatine bone is a part of the orbit of the eye. So if we look through our pictures here, we're seeing an anterior view of the palatine bones. We see a horizontal plate, okay, and we see a perpendicular plate. This is a coronal section, okay, so cut through a crown. Now we're going to look at a sagittal section, and in the sagittal section, we're seeing the palatine bone is forming the posterior part of the hard palate. And now we're looking at an inferior view of the hard palate. So the mandible has been taken off, and we're looking at the hard palate inferiorly, but this would be the part of the hard palate that you could press with your tongue. Okay, that's where we're located now. But if you look at a sagittal view, again, you note that the palatine bone, along with the maxilla bone, have a superior surface. The palate has a superior surface, and the superior surface of the hard palate supports the vomer bone, which is the lower part of the nasal septum. Okay, so what about that vomer bone? The vomer bone is superior to the hard palate here, and here's another view, perhaps easier to see, of the hard palate, partly formed by the maxillae in the anterior, let's say 3/4, and formed by the palatine bone. Okay, and the vomer is superior to the hard palate, and it forms the inferior part of the nasal septum with the perpendicular plate of the ethmoid bone. So here's the vomer in a sort of like a weak kind of pink color here, and it's the inferior part of the nasal septum, and the perpendicular plate of the ethmoid bone in green is the superior surface of the nasal septum. Okay, so we've gone through a lot.